Roybal-Allard for 5 minutes.
Mr. Speaker, this is day 2 of the misguided Republican attempt to repeal the Affordable Care Act. We have been down this road 31 times with the same arguments and the same often misleading rhetoric that does not reflect the true benefits of the Affordable Care Act. Those who argue against it are not speaking for my 167,000 uninsured constituents who for the first time will receive health insurance coverage when the law is fully implemented. And they are not speaking for the 7,000 young adults who can stay on their parents' insurance plans until they're age 26, or the 510 small businesses in my district receiving tax credits to help maintain or expand health care coverage for their employees. Colleagues who support the repeal of the Affordable Care Act are also disregarding the needs of minority communities where millions suffer from persistent and life-shortening health disparities. In my largely Latino district, for example, thousands more of my constituents will have access to health care through the expansion of Medicaid, the creation of health insurance exchanges, and through the law's expansion of community health centers. Mr. Speaker, my constituents do not want the Affordable Care Act repealed, nor do the millions of Americans across our country for which the ACA has brought life-saving benefits. This is most certainly and people with disabilities. Under the Affordable Care Act, being female can no longer be considered a pre-existing condition. Women will no longer have to pay higher premiums than men, and prenatal care will finally be covered for all women in this country. Never again will our sisters, mothers, and daughters have to choose between a mammogram or putting food on the table, because these life-saving preventive health services will no longer require a co-payment. As for seniors, last year, as a result of health reform, over 32 million seniors received free preventive health services, and over 5 million seniors have saved close to $4 billion on Medicare prescription drug costs as the donut hole closes. Because Obamacare's, our families and neighbors with disabilities will no longer live in fear of reaching lifetime limits on their insurance or being excluded from coverage due to a pre-existing condition. Mr. Speaker, the Affordable Care Act is already working for my constituents, for women, for minority communities, and for seniors and people with disabilities. It is time for my Republican colleagues to listen to these Americans who do not want to lose their new health benefits. The Supreme Court has upheld the Affordable Care Act. Let's stop wasting time and taxpayers' money and find solutions to the other complex issues facing our country today. I yield back the balance of my time.
The gentlelady yields back. The chair will now recognize the gentlewoman.